Hi, I'm Justin Riley. Today on Wisconsin Doctors, surgery in a rural hospital. Why that might be the best route for you to go. We'll be on location at Upland Hills Health here in Dodgeville to find out more, and I'll be joined by two very fine members of the surgical team here at Upland Hills Health. Brad Jebbia, who is the Director of Surgical Services, and Jeff Pierce, Certified Registered Nurse Anesthetist. It's all coming up right here on Wisconsin Doctors. Stay right here. Hey folks, welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and today we're talking about some of the surgical services that are offered here at Upland Hills Health. And I'm joined now by two very fine gentlemen, Brad Jebbia and Jeff Pierce. Thanks for having us here, guys.
Thanks for having us.
Good to have you with us too. So I'd like to kind of start out by asking each of you what your role is and what your responsibilities here at Upland Hills Health are. Brad, let's start with you. I understand that you're the Director of Surgical Services. Tell me about your job and your responsibilities here at Upland Hills.
Okay. Well, the surgery department is composed of a number of different areas: anesthesia, case management or surgical scheduling, pre-op, recovery, as well as intra-op, and then we have instrument cleansing. So I see myself as kind of a facilitator and communicator between all those different departments.
Sure.
Mainly though, as a department director, I think it's true at our hospital here at Upland Hills Health, my main responsibility is patient safety.
Absolutely. How long have you been working here now?
I've been at Upland Hills Health for 15 years.
Okay.
I've been a registered nurse for over 20.
Mm-hmm. And what education or experience has led you to this job?
I started off my education with a Bachelor of Science in Forestry Management at Oregon State University. I went into Peace Corps for a couple years after that, and then worked in private forestry for several years. And then industry changes in forestry kind of pushed me into healthcare and nursing. Sure. And I've worked in emergency departments for 15 of my nursing career as a staff nurse, as a department director, as well in ER. And then the last 4 years I've had the opportunity to work in surgery as a surgery director.
Awesome. So this is sort of an act two for you then.
Oh yeah, second career, but yeah. Really it's my main career now.
Yes, oh absolutely, yeah. Yep. So Jeff, what about you? You are a CRNA. Can you tell us first of all what that stands for?
CRNA, the acronym stands for Certified Registered Nurse Anesthetist, meaning that to become a CRNA you need to have a bachelor's degree in nursing. And then to qualify for anesthesia school, in addition to the application, you need to have a minimum of 2 years of ICU intensive care training to qualify as an applicant for anesthesia school.
And how long have you been here with Upland Hills?
I came here in 1984 and I have not looked back. I just love the area, I love the hospital, the facility has grown by leaps and bounds, and
yes.
Back in the 80s we now have everything we could have dreamed of as far as anesthesia provision and equipment and staff, quality staff to work with.
Awesome, awesome. So Brad, I want to switch back to you for a second here. Describe some of the surgical suites that are available and the types of procedures that are typically performed here at Upland Hills Health.
We have 2 surgical suites, and as well as 2 endoscopy suites.
How many surgeons would you say total you have here?
Oh, I don't know. We're looking at, I don't know, would you add them up the other day?
2, 4, 8.
A lot.
Probably,
eight
yeah, 8 to 10
That's
surgeons.
pretty good.
Right.
That's pretty good. For, I mean, it's a rural hospital, 8 surgeons on staff. That's pretty cool. So, Jeff, tell me a little bit about the surgical team that you work with.
Well, Brad's in charge of staffing the department, and he's been able to staff it very well with qualified, personable surgical technicians. We have 4 circulating RNs in the operating room, and what's important is the personalities of these people really mesh with the surgeons. They realize that they're taking care of their friends and neighbors, so they'll go that extra mile to show the compassion and attention to people who are in a vulnerable situation coming here for surgery. And they give that added touch of personal compassion and concern for the feelings of the patients that I think is hard to provide at a larger institution.
Yeah, when you're just more of a number at a larger institution, you really kind of are part of a community here. That's very cool. We got to take a short break, but when we come back, we're going to be talking about a specific type of surgery, endoscopies, specifically colonoscopies. You won't want to miss it. Stick around. We'll be right back. And welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville. And I've been talking with Brad Gebbia and Jeff Pierce, part of the surgical team. And you know, I'm really kind of amazed at the broad spectrum of surgeries and surgical procedures that are available here at Upland Hills Health. But I want to talk a little bit about something more specific, endoscopies, specifically colonoscopies for just a moment.
Interestingly enough, I was talking to one of our family doctors, and he was telling me that with the range of providers that we have, that when a patient comes to him perhaps with some symptoms that maybe indicate a colonoscopy, he can use their different specialties and kind of guide their care.
Yeah, it sounds like there's a good portfolio of different skill sets that are available between those four providers. So that's really nice there. So you know, colonoscopies, you know, as adults continue to age, it's one of those things that people tend to put off. I think that there's a fear of it being uncomfortable or even painful. You know, the two of you can provide, I'm hoping that the two of you can provide some behind the scenes information on this and tell people that it's really not the case. Brad, let's start with you. Can you describe the patient experience when they come in for a colonoscopy?
Sure. I think the patient experience starts even before they come in.
Sure.
They're referred by their family doctor for a colonoscopy at Upland Hills Health. They're contacted by our surgical case managers who schedule the surgery. They not only do that, but they review the patient's medical history over the phone, their medications. They discuss the prep that they have to take before a colonoscopy, try to make that as easy and as understandable as possible so the patient's as well prepared for the colonoscopy. And then you're entering into our department.
Sure.
In pre-op, where some of our staff are cross-trained. You may have actually talked to the person that's taking care of you in pre-op that set you up for your colonoscopy on the phone.
Yeah.
And then, so as we'll talk later, you know, our staff is, we have a lot of excellent staff that prepare you for the procedure, do a lot of education, so that kind of set your mind at ease.
And there's a sedation procedure that you guys do here, which I think is really cool. And Jeff, I'm wondering if you can kind of talk to us a little bit about that. And we only have about a minute left in this segment. But why is the sedation used here at Upland Hills Health more comfortable than where you might find it elsewhere?
Well, at Upland Hills Health, you will have a licensed anesthesia provider overseeing your anesthetic for all endoscopies. And this is something very unique to our hospital.
Yeah.
Also, I like to explain patients when they come in, they're sometimes anxious, they've had to take this prep, and I've had 2 of these myself, and I can say, don't worry, I was across the room last year, and the worst is over. Drinking that prep, you know, going without solid food for 24 hours, that's tough. Having the colonoscopy is a breeze. You will wake up wondering if it has even happened.
Right.
With the anesthetic that we use, it's safe. The risk of having a serious complication from an anesthetic is now 1 in a million. In the 80s, it was 1 in 10,000, so the math is incredible. The safety has never been better. The riskiest thing we do is drive a car. 14 out of 100,000 patients die every year driving a car. 1 in a million chance of a serious complication with an anesthetic. I think that's incredible.
That's pretty good. And I think it's important for people to keep that in perspective for sure. So we got to take a short break, but I've got some other questions for both these gentlemen, Brad Gebbia and Jeff Pierce here at Upland Hills Health. When we come back, we'll be talking more about endoscopies and colonoscopies. You won't want to miss it. Stick around. Hey folks, welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health in Dodgeville, and we've been talking about colonoscopies. Lots of folks think of this procedure as being probably one of the least comfortable or the least, the procedure that they look forward to the least in their lifetime. But at Upland Hills, there's a couple of very interesting and unique things that they do to make this procedure much more comfortable. And Brad, I just want to kind of ask you, can you name 2 things that make the procedure of a colonoscopy more comfortable here at Upland Hills?
Sure. I think one of the unique things that we do at Upland Hills Health during our colonoscopy procedures is during the procedure, the endoscopist needs to gently inflate the colon with a gas so that they can visualize the inside of the colon.
Sure.
Here at Upland Hills Health, we use CO2 gas or carbon dioxide gas. Mm-hmm. It's a gas that's readily absorbed by the gut, by the body, and during the procedure and then afterwards. So really after the procedure's over, the gas is gone. Some people may remember in the past other facilities perhaps use room air, which was used quite frequently and is still used in some facilities. And people that have had a colonoscopy in the past may remember being crampy or feeling bloated. But since we've moved to carbon dioxide or CO2 gas, we don't have any of that type of problems in recovery patients.
Sure.
Don't have any cramping, no bloating.
Wow.
And second, I think we've talked a little bit about it, is our CRNAs providing sedation during the procedure. I think that's really makes a big difference.
And Jeff, I want to jump over to you. Obviously, the patient is sedated during the procedure. A lot of people have, with any surgery where they're being sedated or having any sort of anesthesia, they worry about waking up during the procedure. Mm-hmm. Is that a possibility?
Well, under different forms of anesthesia, it can be a possibility, but here at Upland Hills Health, you have a licensed anesthesia provider with you before, during, and after every anesthetic, including endoscopy. And I've yet to find anybody, and we do hundreds of these, to complain of awareness under anesthesia with anesthesia-provided sedation. I think it's very safe, very effective. One of the concerns is airway management. Mm-hmm. We are airway experts. That's what we're trained in. That's the only concern in anesthesia these days is airway management, and you have an airway management expert with you when you go to sleep, while you're sleeping, and when you wake up. People are waking up faster than they ever have in the past. It's a common statement that, what, it's over? I can't believe it's over already. So the discomfort involved with colonoscopies always occurs before you enter the hospital. Once you enter the hospital, you will be totally comfortable from start to finish.
And hopefully have no memory of it even happening.
No memory.
And we were talking a little bit before the show started about how people literally will wake up from the procedure and say, have we started yet? Mm-hmm. That's so interesting. So
That's fantastic.
You're well taken care of here at Upland Hills. So, Brad, I'm going to jump back to you real quick. Obviously you're providing a really great service to people, and there's a little bit of incentive, more incentive for people to come in and get this checked because it's important. This is an important procedure for people to get in their lifetimes. What are you most proud of when it comes to the equipment and the procedures that are offered within the surgical department in general?
Well, I think we provide a wide range of surgical procedures. We do colonoscopies, we do upper endoscopies, and there are a variety of procedures even within the endoscopy suites that we do other than just those 2 procedures. But really, I think as a department director, my job is to make sure that the surgeons have the equipment that they need to do their surgeries, up-to-date equipment, and I'm always looking for new procedures that we can do. If we have time, I'll mention the sinus surgery that we've recently added.
Yeah, absolutely. And you've had some equipment upgrades and state-of-the-art equipment and so forth. Does this affect cost for the patient?
Being a small hospital, we are fortunate enough to be connected with St. Mary's system.
Sure.
And we're able to purchase equipment and supplies with their buying power. So the equipment and supplies that you would experience at a large hospital in Madison are the exact same material that you're having here at Upland Hills Health.
Absolutely. Well, we got to take a short break. When we come back, we're going to talk a little bit more about trust and quality assurance here at Upland Hills Health. Don't go away. There's more Wisconsin Doctors coming up right after this. Stick around. Welcome back to Wisconsin Doctors. We're here on location at Upland Hills Health, and we've been talking about some of the surgical procedures and services that are offered here at Upland Hills Health. We've been talking a lot about colonoscopies, but I sort of want to talk about a couple other things while we still have time, and I'm going to start with Brad Gebbia. Brad, you have a kind of an updated procedure that you offer here that has to do with sinus surgery. Can you talk to us a little bit about that?
Sure. Recently, our ENT, ear, nose, and throat providers, we have two of them. We have Dr. Eisenberg from St. Mary's, and we have Dr. McDonald from Meriter. So we cover a variety of insurance types. We put the question to them, what are you doing in Madison that we could be doing here? And they mentioned CT-guided sinus surgery. And sinus surgery in the past was done more visually with the eye and maybe a camera, but the technology's moved on to where we've just purchased a CT-guided sinus surgery platform that puts the patient would have a CT scan prior to coming into the OR, maybe a day or even a week before.
Oh, okay.
This technology puts the CT scan up on a monitor here. The doctor locates the patient actually and synchronizes the patient on the OR bed with the CT scan and is able to track his instruments on the CT scan as he does his surgery. The sinus surgery can be complicated, and
sure.
They want to be able to locate their instruments so that they don't violate a space that they shouldn't be going into. Right. So we're offering that now, and like I said before, it's nice because we can cover a variety of insurance types.
Absolutely. And we talked a little bit before the show about how one of the things that you're very proud of is that your staff is very meticulous about cleaning and sterilization before and after each procedure. Can you talk to us a little bit about that?
Sure. This is behind the scenes things that people don't really think of. But for example, colonoscopies. Our scopes are chosen by our providers not only to provide a high definition picture and a study during the exam, but also they're relatively simple to clean. We're trained frequently by our Pentax representatives come out here. We run them through an automatic endoscope reprocessing machine that provides high-level disinfection of each scope after use that's FDA approved. One of the items that is potentially difficult, tricky to sterilize and clean are the removable buttons, the valves that the endoscopists use to provide suction and irrigation during the procedure. We've decided to just simply replace those reusable items with a single patient use item. So we're not even worried about cleaning those anymore. So we just worry about cleaning the scope, which is a relatively simple procedure.
But I think it's interesting to note that, a lot of people think when they think cleaning, they think, scrubbing it off with a brush or something like that. But you actually have equipment to clean your equipment, which is kind of cool.
People are the most important part of cleaning anything, and it's consistent cleaning through different people. So everyone, that Brad does it,
right.
that Jan does it, we're all doing it the same way.
Yeah.
And hand cleaning is really that removes over 90% of any soiling before we even put it into our processor. But I'm very proud of like Jeff says, we have our family members coming to this facility, and we want them to have the best equipment, the cleanest equipment available.
Absolutely. Jeff, I'm going to give you a chance to have the final thought for today, or maybe final series of thoughts. Can you talk to us a little bit about why, kind of wrap this all together and tell people why they should come to Upland Hills Health for surgical procedures?
Well, first and foremost, I think just because it's a small nonprofit hospital, maybe people have expectations in that regard, but when you're taking care of your friends and neighbors every day, you know that you're going to be taking care of VIPs. You're going to see them at Walmart, you're going to see them at Piggly Wiggly, and you have a higher degree of accountability, like the local butcher with his display case versus a larger institution. What's very important to understand for the public to get is that we have top-notch, cutting-edge equipment. We have as good or better of anesthesia machine than is available in larger institutions. And I have the administration to thank for that. They've provided the extra funding needed when I request nothing but the best for anesthesia equipment. We have a monitor called a BIS monitor. This is a very rare, among other institutions, it's a very rare monitor that monitors brain waves. People have concerns about waking up or awareness under anesthesia. This device monitors the EEG, the brain waves with a little sticker on the forehead. And I can assure people that we have cutting-edge technology to avoid awareness under anesthesia. Plus, for every procedure, let me reiterate, we have terrific anesthesia staff. We have a staff of 3 CRNAs, anesthesia providers, that we've handpicked. And the administration has been very supportive when we want nothing but the best. Our latest addition to the crew is Brian Lensmeyer, who the hospital has funded education and training for him to provide chronic pain management. And this guy is good. He's very concerned about his patients, and he has a level of compassion in this local hospital that is difficult to provide at larger institutions. For people who are chronically suffering from pain, he has that compassion that he's very concerned about the feelings of his friends and neighbors.
Absolutely, absolutely. Lots of good reasons to come to Upland Hills Health, and I understand that you're a patient yourself, and so that should speak and give a really pretty strong testament to why it's important to come here. So I appreciate you, appreciate both of you talking to me today, Brad Jebbia and Jeff Pierce here at Upland Hills Health. That's all the time we have for Wisconsin Doctors. Want to make one mention that March is Colonoscopy Awareness Month. That's just a couple of months away. If you are over 50 and you have not scheduled a colonoscopy for yourself yet, get on that pretty soon. From all of us here at Wisconsin Doctors and CW57, we're inviting you to live longer, live better. We'll see you next time.